Drugs that weaken the sympathetic nervous system. So we can go start with the CNS. Okay, in the CNS we have the drugs which affect on the alpha 2 and imidazoline receptors, I1. These preparations are clonidine, methyl dopa, guanfacine, and magnesium sulfate. The mechanism of action of actually these two, these, and these also, they stimulate the alpha 2 receptors of the inhibitory part of the vasomotor center, and it inhibits the vasomotor center reduction of which leads to a reduction of sympathetic effect on blood vessels. Remember from the picture, yes, if we inhibit the CNS, the vasomotor center, firstly, yes, primarily, then the impulse will not go further. The impulse will not go down, yes, so less impulse, less sympathetic impulse to the blood vessels, so less contraction of the blood vessels, so less effect. This is the mechanism of this. These drugs are predominantly sedative drugs. Sedative, which also means reduction of the activity of vasomotor center. Again, less impulse to the sympathetic center, the sympathetic system, and less activation of the blood vessels. Okay, all this is connected to the less activation of sympathetic system and less activation of blood vessels. Then ganglionic blockers. Ganglionic blockers go further. We remember from CNS, we had the preganglionic nerve, yes, then ganglion. In ganglion, we had ancholinergic receptors. So if we're talking about ganglionic blockers, they will block ancholinergic receptors in the sympathetic ganglion. So we remember on the picture again that we had a ganglion in which you could weaken the sympathetic influence on the heart and blood vessels. The drugs are benzoxyconic, igroni, pentamine, beryllium, pachycarpine, and so on. These drugs are effective. Okay, I forgot to tell you about the previous. Let's first go to the previous. These drugs, central acting drugs, they work like stronger. They are strong, effective, yes, and quick effect. So we can use them in case of emergency. For example, hypertensive crisis. Hypertensive crisis. Okay, so direct effect on CNS gives you the strong action and quick action. And exactly clonidine, for example, it is not used nowadays. I mean, in Russia at least. Because it has also many side effects, as it is very strong sedative drug. So it can lead people to unconsciousness because it is really strong. Okay, if you mix it, for example, with any other sedative drug like alcohol, you can even lead the patient to coma. So please pay attention on that. Strong drugs. Okay, next, these drugs, ganglionic blockers, they are also strong, they are also quick, and they drop blood pressure very much. So they are even not used for therapy. Only in surgery. They are used for the controlled hypotension during the operation. This is the only use of these drugs. Seriously, we don't administrate them to people. Why? Because the effect is very strong and it's difficult to control the blood pressure. It can drop it too much. And the second reason is that they also have side effects because they block ganglions, both not only sympathetic but also parasympathetic. So our parasympathetic system can also suffer, like GIT, for example. Okay.